This conference will now be recorded.
Hi, everyone. For this lecture, we're going to be discussing Chapter 2, which is going to be workforce safety and EMT wellness. Very important that we're protecting ourselves on a physical aspect, mental aspect, both during and after our call, and ensuring that we get a good work-life balance. It's one thing that we get dinged on a little bit is being within the EMS field or law enforcement field or fire field. You know, we eat, breathe, and live our career. I mean, it's a calling, not necessarily a job. And as a result of that, sometimes we do a poor job of actually protecting ourselves both physically and mentally. So we have 5 emotional stages. And this is more specifically what you're going to be dealing with as far as your patients. Excuse me. Dealing with your patients, because you're going to have patients that are dying on hospice care, and then also you have family members that are going to be there, and you have to protect them and then also be their patient advocate and be a source for them to try and get through some of these emotional stages. Not to mention EMS providers themselves, they deal with a lot of high level stress situations, and oftentimes they will go through some of these different emotional stages as well. So the first one is denial. You know, if an individual receives news that he or she has a chronic illness that will end up ending their life, a lot of times people will say, no, it's a mistake. It can't happen to me. I've done this, so there's no way that this could happen. Next stage is anger. Oftentimes they take it out on people around them, and they're pissed off about the situation that they're in. The next is bargaining, and oftentimes this comes with a spiritual aspect as well, and in which case the individual is going to try and say, you know, I'll do this, and as a result, hopefully I get 5 more months. And then depression. A lot of people, you know, especially if they're diagnosed with chronic illnesses, chronic issues, they go into a depression state. Keep in mind too, when we get to the behavioral aspects of patients and behavioral emergencies, depression is very prevalent in today's society. Depression is an imbalance of chemicals, but because of the first 3 emotional stages, it's much more prevalent for people going through this. And then finally is acceptance. You know, with acceptance, it doesn't mean that the patient or family member is particularly happy about it, but they do accept their current state or their current role within their life. As EMS providers, we deal with death on a pretty consistent basis. Everybody's going to have their own little way as far as how they deal with death, how they communicate to family members that their loved one has died. There is a lot of emotional integrity that goes into this job to make sure that you're protecting yourself, protecting your patient, and protecting your family. Protecting their family and your family too. So this is a video clip of a couple of different paramedics, and they're discussing their experiences and how they deal with death and dying.
My name is Matt. I'm a paramedic. I've been with American Medical Response for almost 5 years.
My name is Britt. I'm been a paramedic for 5 years.
My name is George. I've been a paramedic for now 2 years.
When we are actually working on calls, it's really fast paced. It's intense. There's a lot going on around you.
It can be kind of hectic, kind of chaotic, but it's a lot of fun. A lot of independence, a lot of thinking on your feet, not having direct supervision, and being responsible for some pretty heavy stuff at times. We have calls that are pretty high intensity, maybe like multiple casualties or children or like big heavy things. They have it's called a critical incident stress debriefing, where they get all the agencies in that were involved with that scene. You just sit down at a table and people just kind of say how they feel.
Like everyone deals with pain or grief differently, and as employees, we do the same thing. You know, it's generally easier because we're not emotionally involved with any of the patients that we're dealing with, and you kind of have to be able to detach yourself emotionally and just fall back on this training that we have gotten. You know, just doing our jobs, physically assessing people, and trying to help in any way that we can. And then we deal with our own emotional baggage afterwards with the debriefings and that kind of stuff.
It's kind of sick, but we make a lot of jokes. All of us do. We have if you don't have a kind of a twisted, sick sense of humor before you start doing this, you end up having it. I think that's pretty common through all of like emergency services, is you tend to laugh at a lot of things that probably most people wouldn't laugh at. I think that's probably the biggest coping mechanism. During it, when it's actually happening, you don't really, at least for me personally, you don't notice it as much as until afterwards when you have quiet time. You kind of sit there and go, and when it kind of sinks in, and because when you're in the moment, at least for me, it's you kind of just do what you're supposed to do, and you don't see, or it doesn't register a lot of the things that are happening around you. I mean, it registers on I guess you'd say a technical level, you know, but as far as emotionally, that part kind of just gets shut off until you have time to kind of sit down and really kind of absorb whatever it was that just happened. And that's usually, for me, that's when things start to correlate between, you know, stuff that may have happened in the past, in my personal life and stuff.
I mean, there's always calls that you run on people and you kind of, it hits a different nerve because, you know, it person might look close to your mom or resemble your mom or have the same accent as your mom, and you see, you know, the pain. So you think of your own family and stuff like that and how much pain that, you know, and you're grateful that they're okay and things like that. So yeah, there's always times that something's triggered something inside of you. It's just kind of how you deal with it afterwards is the big thing. You know, I've been fortunate not to have anybody what I'm really, really close to pass away. And, you know, my first experience with death on a call, you know, it was a younger person. I believe he was in his 50s or something like that. And it's just kind of interesting because, you know, you always hear about someone older passing away. You really don't think of it as the younger. So, you know, it made you appreciate life a little bit more and cherish your friends and your family. And, you know, you want to keep them close and tell them I love you and, you know, I care about you a little bit more.
I was 7 when I lost my first grandparent, and it was a really very surreal experience watching the family grieve and going to the funeral, and I really didn't comprehend the long-term ramifications of having lost my first grandfather. Having lost other grandparents since, there's a very emotional component to, you know, losing a family member, and that you can't really put into words when you're comparing it to death on the job. It's always a very detached focus that you have when we're going into another person's home and we're dealing with death in another person's home. You don't allow yourself to buy into the family's emotional, because we can't. We have a job to do while we're there, and that has to be our primary focus.
Everybody wants to see kind of what's going on, what are they doing, you know, and human nature, we're all curious. We all want to,
Morbid curiosity.
exactly, we all want to find out what's going on. And if it's happening to someone else, it's a lot easier for us to detach. I mean, that's kind of like Brett was saying with our job. People just detach themselves and go look at them and go, oh, ew, look at that, oh. But because it's not related to you, it's not your family, who cares? It's just another person out there.
Generally, fire captains or police officers will try and separate family from the victim, especially if it's an emotionally charged scene.
Sometimes it gets really emotional in there, and you have to ask for more people to come in to help the paramedics separate that. But as soon as someone passes away, we're the first ones really to kind of come up to you, and we try to tell the person we will stay on scene as long as it takes to make sure that that person gets their assistance, either if they need a priest or it's just an ear or a family member, just anything. We're there and we'll stay on scene as long as it takes to make sure that that person feels supported at that time.
It's taught me that everyone does grieve differently. Everyone goes through all the stages of grief, but they don't go through them the same. And there's no right or wrong way. And it's made it, my experience of it made it easier for me to speak about death. And it's made me come to grips with death, and that families deal with it every day. And most of us don't see that. Most of us only have a handful of days in our lifetime where we'll have to deal with something like that.
And it takes that stigma away from death, and you understand that it's just a natural part of life, and everything has a start and everything has a finish.
You never know when your time here is done. I mean, there's been so many times where you see people that are 1 minute driving along, having a wonderful, Valentine's Day weekend, and the next minute one of them is dead because they crashed the car.
Just coming home to your family every night and giving your wife or your husband or your significant other a kiss, or your kids, or whoever it could be, even your dog, just appreciating every second you have, because we've seen things that has happened to young kids. We've seen things happen to old people where it doesn't matter if it's your time, it's your time. And so you just hope that you have one extra day, and every day I feel blessed and thankful that I have one more day and enjoy that and live it out to the fullest.
This conference will now be recorded.
So after viewing that video, just keep in mind that everybody handles stressful situations a little bit differently. Death and dying is a part of the job, but it's not like it's a daily occurrence that you're going to witness it. Keep in mind that out of all the EMS calls that you go on, 80 to 85% are considered basic life support, and then the 10 to 15% to 20% are considered advanced life support, where it's a critical related call. So don't let this chapter or what we're discussing scare you or alarm you. It is an introduction to the concept of mental health and wellness, and just some of the preliminary stuff that most likely you will experience in your career. Now, very fortunate that no matter where you work, there is going to be a veteran paramedic or EMT or firefighter or law enforcement officer that's going to be able to take you under their wing and then really keep an eye on you and give you that umbrella of security. So within stages in the alarm stress, we got 3 different phases that we can kind of correlate to the experience level within a career. So at the alarm stage, the body responds and it immediately goes into a fight or flight response. So think of the very first day that you're going to be going out on a call as an EMT and those tones go off. The fight or flight response is going to drop, and all of the adrenaline within your adrenal gland is going to drop. Within the alarm stage, with fight or flight, your heart rate increases, your blood pressure increases, your respiratory rate increases, and then you kind of get a mind-enhancing drug a little bit. However, with adrenaline, you get very narrow-sighted, and it's very difficult to use all of the different areas within your brain as far as reasoning and rationale. The next stage is the resistance stage. So we're able to deal with those stressors and the body returns to normal in a relatively short period of time. So think of within that stage, the veteran presence. So I've been doing this for almost 12 years now. When I hear those tones go off, the majority of the time I get a little uptick as far as adrenaline goes, and then my body returns to normal. I start using all of the different areas of my brain and start creating that plan as far as what I'm going to be doing on that specific call. The last stage that some individuals experience is the exhaustion stage. So the body fails to adapt to any type of stressor at this point. So with burnout, this is often what happens with a seasoned veteran who's been doing the job for so long and they cannot deal with the stressors anymore, and maybe they lost the passion for the job. Or when those tones go off, there is no response at all, whether it's fight or flight, the resistance stage, there's just no chemicals that are corresponding within that individual's brain. So we have three very common reactions to stress. We have the acute stress response, the delayed stress response, and then the cumulative stress response. So acute stress response, this is going to be emotions and response to a specific incident at the very same time that we're dealing with that and or very shortly afterward. So a lot of times this correlates into major catastrophic events where you're responding to an earthquake with a mass casualty incident component or a line of duty death or a active shooter response where there's so much stress and there's so much emotion going on that everything falls at that specific time. So your signs and symptoms are going to be immediate from that stress response. You could feel overwhelmed, maybe depression, anxiety, crying, what have you. The next stress response would be the delayed stress response. And again, most of the time, this is going to be correlated to a specific incident. Within that specific incident, high stress, however, you don't feel the signs and symptoms from that specific incident until maybe days or months or years later. The signs and symptoms are similar, or you might see depression, anxiety, guilt, fear, but again, this is going to be delayed. And a lot of times what ends up occurring with both the delayed stress response and the acute stress response is how an individual actually copes with this specific incident. And unfortunately for fire, EMS, and law enforcement, a lot of times they end up falling on alcohol and or drug-related coping mechanisms. Now later on, we're going to talk about some healthy lifestyles so that we don't negate ourselves and start utilizing poor stress response coping mechanisms. And then the last one, which is a very common experience within fire and EMS, is the cumulative stress response. So over time, you start to delay some of those signs and symptoms that are similar to the delayed and or the acute stress response, but it's not from a specific incident. It is from a multitude of calls and experiences that you've been on throughout your career, and they continue to build and build and build. Now, this is a result of individuals not really dealing with the stressors of their job, bottling everything up, and eventually we're going to get to a tipping point and everything's going to free flow out of us. So again, not a scare tactic. This is an informational aspect in order for you to start preparing yourself now as EMT students with healthy lifestyles, healthy thinking, creating that work-life balance so that you don't succumb to some of these instances. But again, this is statistics as far as mental health and how it's plaguing the EMS system, fire system, and law enforcement system. And we can see that per average, based on the CDC, we're substantially at a higher risk rate for depression, suicide, and suicidal contemplation, as well as post-traumatic stress disorder. So the reason is why. Black and white answer, what we're dealing with on a regular basis is a high stress event, and what we witness, really no human being should succumb to those types of stressors. You know, we are getting called to specific instances where it's basically the worst call or worst instance of somebody's life. And why those statistics are so high is the fact that for years and years and years, as EMS providers and fire department providers and law enforcement officers, we haven't dealt with those stresses very well. Oftentimes we've bottled up those emotions and we don't really like to draw attention to ourselves as far as maybe an area of weakness. But don't hesitate to ask for help if you're dealing with anything, whether it's work related or life related. Within the EMS field, we are a family. We're very similar to a sports team where we care so much about the coworkers that we work with. So how do you take care of mental well-being? First, really focus on your work-life balance. That's where a lot of us get in trouble is we spend so much time in the ambulance or so much time at the fire hall. You know, we're working overtime shifts, we're picking up extra duties and stuff, and we end up working 70, 80, 90 hours a week. And we don't have that proper balance between, you know, the happiness and the joy that comes with being a part of a family or enjoying the hobbies and activities that we like to do that we're not thinking about work. Physical wellness is such an integral part to as far as mental well-being and physical well-being. When we do work out, when we do provide that physical activity, what we're doing is we're releasing endorphins and dopamine into our system, and those are naturally occurring chemicals that make us feel good and go to a euphoric state. Nutrition, very important as well, because this correlates to our physical well-being, and then the proper nutrients also correlate with our proper mental well-being. And it's very easy. You're in the ambulance, it's hour number 14, you're on your 10th call. I'm starving, I'm going to get 3 Big Macs and a large fry and a large chocolate shake. That's not good, proper mental well-being or physical well-being, and we all know the ramifications of eating too much McDonald's. And then, of course, we have different programs that assist EMS providers in the event of a major incident, and that's critical incident stress management. So oftentimes this is going to take place a couple of days after a very high acute stress call, and there's going to be professionals that are going to come in, maybe some spiritual leaders that are going to come in, and we can sit down and discuss our thoughts and our feelings, what happened with the call. And it's an open format. I've been involved in quite a few of these. It's very nice and it's good to decompress some of those thoughts and feelings. Now this is more of a formal stress debriefing, and then you have an informal, which is constituted as a debrief, and then this usually happens about 8 hours after the event, and it's just with the individuals who were on that call. So oftentimes this will take place around the kitchen table back at the station. The captain or the lead medic or the lead EMT, what have you, usually that veteran presence will lead kind of the debriefing, what went well, what didn't, how do you feel about it? And again, that's a very good coping mechanism to get your thoughts and feelings out there so you're not bottling them up. We also have on-scene well-being. So when we start diving in patient assessments and our activities on scene, I'm going to hone in on the fact that the most important individual on that scene is you and the other emergency rescue providers. Because if we go down, then nobody else is there to help us, and then also help that patient. So before we even go on our first call, we want to make sure that we're up to date on all of our vaccinations. really important, especially the hepatitis B vaccination. That's a very common disease that can be transmitted through blood, through bodily fluids, through needle sticks. So make sure that you're up to date on your vaccinations, your flu shot, and you're keeping up with all of your medications and your physicals as well. Now, when we actually get onto that call, very important that we're protecting ourselves as far as personal protective equipment. So this is a new challenge that you guys are going to be experiencing, that this is going to be kind of a norm because we're dealing with COVID right now, and it is totally normal for every call to have eyeglasses on and a mask as far as N95 and maybe a gown and multiple sets of gloves. When I first started out, and a lot of the veterans that are currently dealing with this right now, I mean, it's basically just been gloves and you. And so it's been kind of a weird transition period for us to better care for ourselves with the proper PPE on every single call. But always think of what you need as far as PPE and then upgrade that a level. And that way you're going to be better protected. Always a good idea to carry extra gloves in your pockets as well. And then we have situational awareness, and this is going to come with time. Situational awareness on an emergency scene is very difficult to grasp when you're a student and we're doing mock scenarios and situations. It will come with time once you get out in the field. But when I'm talking about situational awareness is that there's a lot of different ailments within that scene that can make it unsafe, whether it's weather considerations, dogs, drug paraphernalia on scene, possible hazardous materials event such as carbon monoxide, or maybe we have a full-blown explosion like the Husky refinery explosion. Keeping your head on a swivel and being able to multitask is very important with situational awareness, where you're still treating your patient, but you got eyes on the back of your head to make sure that your surroundings are not enclosing in within you. Proper doffing of the PPE. So this is more after that call is done, making sure that whatever's on us, whatever's on our PPE is not coming into contact with my physical body. And this is where the most individuals who are healthcare workers are contracting COVID right now, is improper doffing, in which case they might take off out of sequence as far as their equipment goes, or touch their face before they wash their hands, or itch their eye, what have you. It's got to be a very methodical movement when you are removing your PPE. After the call well-being, wash your hands thoroughly. You know, what they say is, say the ABCs, count to 30, what have you, and there's like 3 pages in your textbook that talk about washing your hands. Everybody knows how to wash their hands. Everybody's done a really poor job of washing their hands and a good job. Make sure that you're doing a good job of washing your hands after the call and methodically throughout your shift. Because remember, you are working in a dirty environment no matter where you go, no matter how much you sterilize your rig or the station and stuff. I mean, germs, bacteria, fungi, viruses, they are absolutely everywhere. And again, we are working with a lot of sick and or hurt people. So they get transmitted to us relatively easy. So stay as clean as possible, wash your hands a lot throughout the shift, refrain from touching your face, and use your PPE even after the call is done and you're washing. Replace any soiled items, and then also sanitize any equipment that you can utilize on a consistent basis. So for example, it's not like we're going to be throwing away a blood pressure cuff after every call. Make sure that you're sanitizing it really well. And then of course, if there is an injury, if there is an exposure, if there is an illness, make sure that you're going through the proper channels as far as documentation and following up with your manager and or your supervisor, filling out that work-related illness first incident report so that you are covered under workman's comp. That's very important. Even if you slip and it's like, oh, I kind of got a strain, it kind of feels funny, but I'm fine, document it. because you don't know how you're going to feel when you wake up the next morning. If you don't go to the doctor, if you don't fill out that paperwork, you might be SOL as far as workman's comp goes. And then defusing and critical incident stress management, again, very important after the call as far as mental health and physical health as well. I hope this chapter didn't alarm you too much. Again, we are introducing you to the high-level stress atmosphere that can occur within the EMS field, but I hope I gave you plenty of tips and tricks as far as how to prevent that. Everybody's a little bit different as far as how they deal with that stress management. So find your own and really exercise that. Now, me personally, I love to read. So I have a major incident, cardiac arrest event, major trauma event. I really like to dive into a book that's not related to EMS or fire or law enforcement. Maybe it's a Kurt Vonnegut Jr. book and it's Slaughterhouse-Five, something that's going to take my mind away and I can decompress slowly and gradually. So that eliminates chapter 2. What I would recommend you doing, diving deeper into the mental well-being of EMS providers, is watch the movie called Bringing Out the Dead with Nicolas Cage. It portrays some really good characters within the EMS field. Nicolas Cage plays a paramedic in New York City, and he is dealing with cumulative stress and then also acute stress responses. He's also suffering from post-traumatic stress disorder from a specific call that he's on, and it's very difficult for him to actually embrace himself and move throughout his career. And then you have a couple other characters within the EMS field in that movie too who are really good at responding to that stress and mitigating that stress. John Goodman's in it, and he's very good at still enjoying life even though everything that's crashing down around him. So again, I would highly recommend that you guys watch that movie. All right, thanks everybody. That concludes chapter 2, and I will see you later.